If you're dealing with neuropathy, you know the pain, the burning sensations that you have in your hands and feet. Well, you may have been told that there's nothing that can be done about it. Well, that may not be the case. Joining us this morning is Dr. Patrick Sartz of Neuropathy Treatment Center of Arizona, and he has a way that he may be able to help you. Let's talk about, first of all, Dr. Sartz, what is neuropathy? How is it caused?
Neuropathy is actually a secondary disease process where something interferes with the ability to get oxygen to the cells at the ends of the nerves at the skin level. And it causes those cells to actually die off and start to develop the symptoms that you mentioned earlier. Our treatment protocols are actually threefold. We do it to increase a compound in our body called nitric oxide, which was discovered in '92 and the Nobel Prize in Medicine was awarded to in '98. What we do is that we increase that compound so that we can actually absorb oxygen and nutrients at a cellular level. Then we use a specific wavelength of infrared that stimulates the mitochondria, which actually causes a replication or regeneration of nerve cells back out to the skin level. And then we use an electrotherapy that's actually used by the Cancer Treatment Centers of America to offset chemotherapy-induced neuropathy, which further causes regeneration of those nerve cells and education of them so they'll learn how to fire correctly.
Wow. Okay. Is there any published medical research that shows that your protocol actually works?
Actually, in the last 20 to 25 years, there's been hundreds of articles that have been published in medical journals around the world. The one that I really like to refer to the most is one that was published about 9 years ago that actually showed by biopsies where pre and post that they could actually increase the nerve density at the skin level by a little over 400%. So we are actually reversing the neuropathy.
Wow. Okay. Well, is there any published research that shows that the treatment doesn't work?
There's a lot of those too, unfortunately. Okay. But you need to actually read through the entire research. And I'm going to use one as an example. It was published in Diabetes Care in 2008, and it's actually been on the American Diabetic Association's website for years. But if you will read through the entire thing, you'll get to the last paragraph, which I would like to read to you.
Okay.
We did not enroll subjects on the basis of symptoms of painful neuropathy or balance impairment. So most of our study subjects did not have severe symptoms. Our results did not identify any difference in pain or balance in the patients treated with the infrared or the sham therapy. However, we didn't probably enroll the optimum study population to evaluate these outcomes. I treat people with symptomatic neuropathy, and I'm successful at doing it.
Well, let's talk about that success rate. You've been doing this since 2008. Tell us about your success.
Well, in 2008, I was a little below 50%. But in the last 13 years, I've learned a lot, and we've grown from that. And now our success rate's a little about 98%, not quite, of all the patients that we've actually treated.
Okay, so you've upped your game, obviously, since 2008. Like you said, you've learned a lot. When people come in to see you, generally, I'm sure everybody is different. Is there a possibility that it's so far advanced that you can't help them?
There's a point, but it really has to be quite advanced. We have actually been able to reverse neuropathy in people that actually have no feeling of any sensation in their feet. If it starts to go into their calves to that same level, then unfortunately, we're not able to help them.
Yeah, well, and the whole point of you talking to us is don't let it get that far. Don't let it get that bad. When you discover it, you need to treat it right away for the best success, I'm guessing. Is that right?
That is correct. The sooner that you start to realize, I just had a patient in here that had it for 2 months, and already he's within a matter of a couple of weeks, he's almost back to normal.
Oh, wow. That's good news. That is great news. Dr. Sartz, thank you for sharing all of that research and really kind of overseeing the naysayers on that one with all of your documentation. Thank you so much. I want to tell the viewers about a special offer that you have as well. The first 20 callers who call and get a free neuropathy consultation. Neuropathy Treatment Center of Arizona is located at 2150 South Country Club Drive in Suite 14 in Mesa. Call 480-556-1358 or visit the website freeneuropathyconsultation.com.